We are focusing on type 2 diabetes mellitus, a topic heavily tested on the NCLEX. The central issue in type 2 diabetes is insulin resistance. Unlike type 1, where the body doesn't produce insulin, here the pancreas is producing insulin, but the body's cells are ignoring it. The exam will test this distinction, often in questions asking you to differentiate between the two types. Think of it like a key that has become worn and no longer fits the lock properly. Because the cells are resistant, glucose can't get in to be used for energy, and it builds up in the bloodstream. Over time, the pancreas gets overworked trying to produce more and more insulin, and may eventually start to fail, leading to decreased insulin production as well. Expect to see select all that apply questions regarding risk factors. The classic patient profile for type 2 diabetes includes central obesity with an increased waist circumference, a sedentary lifestyle, and a family history of the disease. The NCLEX will also include metabolic syndrome components like hypertension, high triglycerides, and low HDL cholesterol. A history of gestational diabetes or delivering a baby over 9 pounds are also significant risk factors. The clinical presentation is often subtle, which is a common exam trap. While the 3 Ps, polyuria, polydipsia, and polyphagia can be present, the NCLEX is more likely to present a patient with vague symptoms like persistent fatigue, blurred vision that comes and goes, or recurrent infections, especially yeast infections or urinary tract infections, because the high glucose environment is perfect for bacterial growth. When it comes to medications, Metformin is the star of the show. The exam requires you to know its primary action, which is reducing glucose production by the liver and increasing insulin sensitivity at the tissue level. The most critical safety point, and a favorite exam question topic, is its contraindication with iodinated contrast dye used in CT scans. The combination can lead to kidney injury and the development of lactic acidosis, a rare but life-threatening complication. The rule is to hold metformin for 48 hours before and after the procedure, pending kidney function tests. You must be able to identify this as a priority nursing intervention in an exam scenario. A major acute complication tested is hyperosmolar hyperglycemic state, or HHS. Do not confuse this with diabetic ketoacidosis, or DKA. In HHS, the patient has profound hyperglycemia, often over 600 milligrams per deciliter, and severe dehydration, leading to a very high serum osmolality and significant neurological changes like confusion or coma. The key difference is the absence of significant ketones and acidosis, because there is just enough circulating insulin to prevent the widespread fat breakdown that causes DKA. For the NCLEX, your number one priority in managing HHS is massive fluid resuscitation with isotonic normal saline to correct the severe dehydration and improve tissue perfusion. This is done before starting an IV insulin drip. A simple way to remember the signs of a blood sugar emergency is the phrase, cold and clammy, given candy, for hypoglycemia. This describes the patient who is cool, pale, diaphoretic, and possibly confused, indicating they need a quick source of sugar immediately. Conversely, hot and dry, sugars high, describes the flushed, warm, dry skin of hyperglycemia. Finally, patient education is a massive component of the exam. The NCLEX loves to ask about priority teaching points. For foot care, the most important instruction is to inspect feet daily, using a mirror if necessary, looking for any cuts, sores, blisters, or redness, as peripheral neuropathy can mask injuries. For sick day rules, you must teach the patient to never stop taking their insulin or oral medications, monitor their blood glucose more frequently, such as every 4 hours, and drink plenty of sugar-free fluids to stay hydrated, even if they are nauseous and not eating.